You're listening to The Chelsea Insider, connecting the neighborhood to public safety, February 2024 edition, serving residents of Atlantic City from Texas Avenue to Annapolis Avenue.
Mental health, addiction, and homelessness affect our families and communities in deep and painful ways. Each individual has unique challenges, and the solutions are complex, long-term, and depend on institutions that can be difficult to navigate. Atlantic City has more than its fair share of at-risk individuals. The 2023 point-in-time count, the only official data on the number of those experiencing homelessness in Atlantic City, estimates 343 homeless individuals. In this edition of the Chelsea Insider, we examine this issue and its effect on the Chelsea community. The goal of the newsletter is to provide information, let the community know about Chelsea EDC efforts in this regard, and recommend actions that can be taken by residents and businesses. Our priority is that every individual has a safe and supportive environment with access to healthcare and other services that ensure the highest long-term quality of life possible. There are numerous obstacles to this goal, from a national housing shortage to individuals with mental health and medical conditions. Housing first is a common sense approach to addressing the needs of the at-risk population by providing shelter as a first intervention. Chelsea EDC has been working tirelessly with property owners, developers, and government agencies to remove the obstacles to creating more housing for all members of our community. One important question is whether the resources exist to help. From our experience, yes, but that help depends on the individual taking steps, such as applying for identification, attending recovery meetings, or accepting housing that is offered. When this is impossible due to mental health or addiction, what are the community's options? Homelessness is the furthest thing from a crime. However, oftentimes, life on the streets leads to illegal behavior, such as aggressive panhandling, building encampments, and sleeping on private property, and urinating in public. As a result, the financial and emotional strain on residents, businesses, police, public works, institutions, and social service workers, as well as taxpayers, is overwhelming and unsustainable. Here are some suggestions to help the community cope. Join us in advocating for non-police social service 24/7 hotline number to get help for at-risk individuals in Atlantic City. 2, support the organizations that provide services rather than handing money to at-risk individuals. 3, call 911 or the non-emergency police number and request a social worker if you see someone in need. 4, businesses should call the police if individuals are interfering with their operations or bothering customers. 5, provide feedback and your opinions to Chelsea EDC and elected officials. This is a difficult topic. We have more questions than we have answers. We will keep asking, and we urge the community to be part of the discussion. The solutions will take all of us working together. For now, we ask the community to contribute to the many social service organizations that do this challenging work. They can be found at www.chelseaedc.org/hope. Elizabeth Terenik, President, Chelsea EDC.
In 2023, the Chelsea EDC Public Safety Team, in collaboration with the Atlantic City Police Department, led a groundbreaking initiative collecting statistical data on crime and public safety perceptions within Chelsea. Using resident survey responses as a guide, our team employed a two-pronged strategy, tracking detailed crime data along with social factors that affect community perceptions in our district. In the realm of violent crime, there were 79 assaults throughout Chelsea in 2023, including 68 aggravated assaults, with 19 involving firearms. This averages about 1 assault every 4 days in the district. Despite a surge in the summer's population, Chelsea's assault rate remained stable over the year, marked by noticeable spikes on March 27th and April 2nd of 2023. Addressing the social factors of safety perceptions, our spring survey revealed that unhoused population, notably impacted decision making in Chelsea. With no homelessness data on Chelsea specifically, our team conducted 6 a.m. counts over 12 weeks, consistently revealing an average of 22 unhoused individuals in targeted areas. We cross-reference our findings with the 2023 NJ point-in-time count by Monarch Housing Associates and found that our count represents 11% of 195 total unsheltered homeless in the city. The data also exposed Atlantic City's total unsheltered homeless population significantly surpasses neighboring municipalities like Pleasantville with 28 and Egg Harbor Township with only 1. Over the course of the year, we will continue to gather data, looking for solutions to chronic homelessness in Chelsea and Atlantic City.
During the community input phase of the Chelsea 10-year plan, the need to address the at-risk population set the foundation for one of the plan's 44 strategies. Strategy 2.1, Interventions for a Safe Community, calls for us to partner with social service agencies to provide outreach, identify and refer individuals for health, housing, and social services focused on long-term solutions. We learned quickly that this was no easy task and would take a lot of time and resources. Over the past 3 years, we have worked with many of the city's social services, as well as the Atlantic City Police Department and the Atlantic County Prosecutor's Office to help at-risk individuals. These agencies have an extremely difficult job. In November of 2022, Chelsea EDC contracted with Rise Up AC to engage with at-risk individuals and connect them with services for or with their families. Rise Up AC works after business hours, on weekends, and on holidays. They also work with Chelsea EDC funded detail officers to offer services, nutritious food, healthcare, and rehab opportunities. In 2023, Rise Up engaged individuals in Chelsea, and their work resulted in 30% of those individuals receiving housing or a bed in a care or rehab facility or returning to their families.
To follow up on concerns from Chelsea's merchants on the challenges they face from the at-risk population, we researched the economic impact. Costs related to an unhoused population come in various forms, from lost revenue for businesses near homeless encampments to increased public works costs to clean up public spaces. Unfortunately, the connection between homelessness and diminished economic development appears to be poorly researched overall. One economic aspect of homelessness that has been well studied is the cost of unhoused populations on local healthcare systems. A National Institute of Health article notes that spending more on housing for the homeless can result in savings overall due to the tremendous cost of treating unhoused populations in hospital emergency rooms rather than primary care. Based on expense data from NIH and early projections of the unhoused population in Chelsea by CEDC, Chelsea Economic Development Corporation, we estimate the cost of unhoused individuals in the Chelsea community could easily exceed $400,000 annually for healthcare alone. Importantly, this figure does not account for lost revenue from businesses, increased police and public works expenses, or the cost of reduced tourism in the district, which have yet to be adequately studied. Given the broad nature of the unmeasured expenses, the total cost of homelessness in Chelsea could exceed $1 million annually. For a full Chelsea EDC report written by Bluestone Services, see the website www.chelseaedc.org/bluestone.
Become a proactive citizen and speak up. Choosing to support social service organizations with your donation is more impactful choice than giving money directly to individuals. These organizations are skilled at addressing broader social issues like poverty and education gaps. They can implement effective programs, reach more people, and ensure lasting positive change. With transparent reporting, they provide donors confidence in the impact of their contributions. By backing these organizations, you play a vital role in fostering long-term solutions and building a better society. Contributing to social service causes is straightforward with Chelsea EDC. Their platform allows everyone to easily support various needs, from helping at-risk individuals to contributing to mental health initiatives. By choosing a cause that resonates with you, making a direct contribution becomes effortless. Chelsea EDC empowers everyone to make a positive impact on issues that matter most. Scan QR code or visit www.chelseaedc.org/hope to find more information.